All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer. I want to show you what I'm doing right now. We are now on to our laser portion of this acne scarring combination. We did Bellafill first for some of the deep scars, and you can see the Bellafill filled everything out. I mean, it actually did a really good job. Now we're using the Deep FX laser on the larger area of deep scarring, and then we're going to go on top and do the superficial active FX. Here's the thing, you guys. Scarring takes a combination. It also takes multiple treatments. She's had this done once before with amazing results, and now we're doing a bigger treatment again before she goes into her maintenance phase. This is one of those lasers where you have to have patience because there's risk of hyperpigmentation. It takes a long time to see the results of this. So a lot of my patients that either have issues with lasers or results is because they don't have as much of the patience. My patient here today has done this before. She actually knows what to anticipate, how many days it took for healing, and then she also did a really strong deep setting, which is what we're doing right now. And that is probably why it lasted for so long for her to see this amazing outcome with a lot of transformation in her skin scarring, because this is long-term collagen production. This is going to be the deeper treatment. I'm going to take a look really quickly and make sure we hit every area. This is going to be the deeper treatment that's going to get collagen production over a 3 to 6 months, even up to a year time period. And so a lot of patients can develop hyperpigmentation from this. They can get prolonged redness from this type of treatment. So you have to have a lot of willingness to relax and give it a little time to heal. Let me take a look. Hold this a second. Take a look at the other side. Hold on. You're good. Relax right now. Everything looks really even. You can see this uniform redness. Same thing here. So I think we're ready to go to active. So while you're switching, I'll talk to them about the active. I'm going to give you the ice pack and I'll put this last side and give that to you. So now we're going to switch over. So you guys take a look here. Come on in. This is what the deep looks like when it's at about 10-15% density. When you go higher than that, there's more blood. This is all she really needs because she doesn't have aggressively deep scarring. And now what we're going to do is we're going to come to the surface. We're going to really remodel. And she's done, again, she did a really strong treatment in the past.
Does it burn for her afterwards?
So yes, this is going to feel like a sunburn. It's also why we do all this numbing, because the numbing really helps kind of calm the skin down for the next few hours. And the next few hours is when the swelling comes, when the redness comes. So we want her to not feel that. So we're going to do that. So we're switching right now to the active. And currently, you guys, on the market, this is still the gold standard. This is what the government uses for burns and scars. So we're going to go strong. I'm going to do what I did last time. Our skin's prepared. Perfect.
So those glasses look goofy, guys. These are our protective eyewear from Innovative Optics right now.
Take a look, you guys. We actually created these goggles.
We even have our name on them.
And then also the tongue depressor. We made these customized because they're the most amazing goggles that are out there. Innovative Optics, you guys can see right here. They're the best goggle eyewear company. And I help them make the best laser goggle. And that's this. So we partnered with them to create an amazing goggle. I'm going to start on her chin cheek area. Here we go. And you guys can see the strength of this treatment. This is literally burning in fractional columns the skin surface. You're doing really well. We numbed all the areas the best we can, but as you move laterally out of the face, from the mid-face, you feel it a little bit. How is this on a 1 to 10 now? 5. Okay, that's what I figured. Most people say 3 to 5. I'm trying to make it done as fast as I can for her. And we're doing a pretty high density. You guys can see there is spacing between the columns, but we're doing a pretty high density because she's done it before. and she had a really good result from it before. So I just want to get it done for her and do an amazing treatment again. The plan would be 8 to 12 weeks from now to just start some maintenance treatment. Fraxel, Moxie, or Halo. Fractora is a microneedling radiofrequency without any downtime. Regular microneedling. Anything. And if we feel we need more Bellafill, we can decide that in 3 to 6 months.
We have a lot of questions about consultations, guys. To get a consultation with Dr. Emer or one of our great treatment coordinators, you can go to emeragecosmetics.com. We offer in-person and virtual consultations.
Really, we're getting there, halfway down with the cheese. So she's doing really good, you guys. Even with the numbing, the nerve blocks, and topical, there's pain. So she's really doing phenomenal.
What can someone with darker skin do for acne scars?
You need to consult with us because there's so many options. Microneedling radiofrequency, microneedling, at-home derma rolling, and peels. Tell them how to consult with us. Also tell them about peels that we have on Emerage Cosmetics.
Guys, you can go to emeragecosmetics.com for in-person and virtual consultations. If you can't make it to the office, guys, we offer skincare consultations where you get some great skincare at emeragecosmetics.com. And we do have treatment coordinators who can suggest what you should get. Is this CO2, guys? Yes, this is our CO2.
And yes, this is our CO2. So that's halfway done, you guys. So I like to feather the edges just to make sure it's all very blended. I'm going to leave the cheek, the forehead for now. I'm going to fix your hand, take your left hand, turn all the way, sorry, your right hand, turn all the way to the right. So now you guys can see here, it's already a little pre-cooled. I'm going to start on this side. And she's evenly red. You see, that's perfect. That's exactly what we want it to be. Perfect. That even pinkness is exactly what we want. That's the deep collagen production from, can you move that dog? Perfect. That's the deeper collagen production from the laser. Now we're on the surface. Now, don't be shocked. Even though this is a surface laser, you can see the actual burning the column. This delivers a lot of heat, and that heat goes laterally and deeply. So she's going to still get a lot of collagen production. The difference is, though, we're going to see a lot of peeling. So over the next 10 days, 5 to 10 days, we're going to see a lot of peeling. She'll probably be a little irritated, a little red. Beyond that, but the last time she did this, it was great.
Can you use CO2 on the eyelids?
You can. We can put in eye shields and do it. We have videos of that on YouTube. Tell them how to go to YouTube.
Guys, we have links in our bio. Go to our link tree. We have links to our YouTube, our TikTok, many other great resources for you to see tons of other procedures and treatments being done.
And this is really to help her acne scars. That's why we're doing this. But some people will do this every couple years for just rejuvenation purposes. They want their skin to look better. It's just really important you do this with the right prep.
Will CO2 melt filler if you have it?
It does not. No, not at all. If anything, it actually activates the sculpting.
Can she feel anything right now?
She can. She was saying it's about a 5. How are you feeling now? What do you think? Still a 5? As we move to the forehead, it should be a little less, I hope, for her. Because the nerves here are more easily numb. And you go all the way up to the hairline, you guys. But it's almost done. I mean, she's really quick. The active is much faster. Why? Because the diameter of the dot is 1.2 millimeters. It's 10 times bigger than the 0.12 millimeters of the deep FX. You bring your head straight. Do you switch the ice pack to the other side now for her? Okay. And now we're going to finish. In the midline, she'll feel a little bit. She's doing really good. You go all the way up to the hairline. Still feel a little here. She's doing great. She's very motivated, you guys, to get a great outcome. And what I think we should do is in a little bit, about an hour, when she's ready to go, we do a quick testimonial, either on live or we videotape it so people can see what it's like. We've done that before. And that's it. What other questions they ask you, Jordan?
What is this procedure? What are we doing, guys? We are giving her laser treatment right now with our Active and our DFX for her acne scarring. This can also be done for skin rejuvenation. Right now, this is her second treatment. She had great results the first time a couple years ago, so she's back for some more.
We just got to keep it going, you guys. It's like working out. You got to maintain. And have a little left. Perfect. And I'm very meticulous, you guys, with how I do this. Now what I'm going to do with your nose, go a little bit smaller. I'm going to go over the nose just to blend everything. Get rid of some of those pores. And again, using our eye shield from Innovative Optics and Jason Emer's lab, you guys can see it protects her eyes at all angles. Let me turn a little here. So I can go all the way up her eyelid. Go around her piercing. And go a little closer to her eye just for rejuvenation purposes. Good. This is preventative for the crow's feet area. Okay. Blend everything. Perfect. And that's really it, you guys. Perfect. Now I'm going to take a quick look. I'm going to take everything down. I'm making sure the edges are blended completely. And have it right a little bit. I'll blend the edges here. And then we're going to put our healing protocol on. Perfect. Okay. That was good. Now, we're going to go to healing. So we're going to microneedle here, PMT, so keep your eyes closed, okay? Just so it doesn't get irritated. I'm going to put a lot of hyaluronic acid. We also combine this with Emerage Skin Hyla B and PRP. And we're going to place that on the skin. We're going to get her really, really moist. We want to protect her skin barrier. And now we microneedle. So she's going to get a little, maybe a little bloody on this. But this is pushing the PRP, this is pushing in the Hyla B and the hyaluronic acid from Emerage Skin into the skin, along with our barrier gel. And this was I was one of the first people to do these types of combinations where we combine these treatments, and the results are better, you guys, much better than if you don't do this with the lasers. It just doesn't improve the results. So I'm going to be a little bit stronger over some of her scarring area that I pre-marked. So you'll be able to see I'll do some bleeding here. It's called the stamping method. And that same thing over here. And then that's it. How terrible was it?
Not bad.
Not too bad compared to what you would think, right?
Mm-hmm.
Especially with all the nerve blocks and everything. And I like having the blood here. We want to keep the blood on her skin. It really helps her rejuvenate. And helps the healing process. And that's it. And then 7 to 10 days, she'll be back to being a light pink and back to her normal activities, guys. Whatever questions they have, otherwise we're done.
That's all I got. All right. Thank you guys for joining.
All right, bye, guys. Cool. All perfect. Okay, great.